Hello, I'm Paul Hoover, the president here at Kettering Health Hamilton, and I am joined by Carla, who is a surgical assistant here at Kettering Health Hamilton, and I'm also joined by Dr. Krista Migliore, orthopedic surgeon extraordinaire. So Dr. Migliore, tell us a little bit about the types of orthopedic surgeries that you do.
Well, I do all kinds of orthopedic surgery. I do joint replacement surgery. I do sports medicine. I do ACL reconstructions and stability of the shoulder, hip arthroscopy, so I kind of do a little bit of everything.
Now, you did a special emphasis in sports, is that correct?
Yes, I did. I trained in Indianapolis. I got an opportunity to work with the Indianapolis Colts and get exposed to the NFL world, and it was fantastic.
Well, terrific. Well, we're here to talk about the robot and how it has changed the way in which you're doing knee replacements. And Carla is your right-hand person.
Yes.
Is that correct? So maybe just start and tell us a little bit about Carla, what she does when we're here in the operating room.
Sure. So Carla's worked with me for about 10 years, and she assists me in all cases, and she works just like she was my resident, and absolutely is key to all cases I do.
That's terrific. Now, Carla, why do you like working here at Kettering Health Hamilton?
When I first came here, I did all specialties. They were very warming when I first came, and then I ended up with Dr. Migliore, and she is my sole reason why I stay at Kettering. Like, her skill set is just the best I've ever seen.
Yeah.
So I will back her wherever she goes.
Now, we hear horror stories sometimes on television about surgeons in the operating room. How is it to work with Dr. Migliore?
Well,
Other than our arguments over music.
yeah, she doesn't like country music, so
No.
that's a problem.
Okay, no country music.
No, she's fantastic to work for. I feel like she treats all the employees like they were friends and with all the respect that they deserve. And I think that's why people follow her wherever she goes.
Well, terrific. Well, we're here with the Mako Robot. So, Dr. Migliore, maybe tell us a little bit about how the robot has changed the way you do knee replacement and what our patients saying about how they feel with the old way, old way of doing knee replacement, and now with the robot.
So, I mean, the robot, excuse me, the robot's been such a great thing in my practice because it helps me as a surgeon get a little bit more precise when it comes to helping this patient get the best knee replacement possible. They get a CT scan ahead of time, and we use this program to upload their images, and from there, we get a little idea about where our cuts need to be, what sizes they're going to be, how's it going to fit, and how's it going to balance. And so as far as balancing a knee, which is key to success, I think it really, really makes a difference. It's a lot more precise. It's a lot more tailored to the patient's anatomy so that we're not cutting everybody in the same shape and curves. They're getting a more custom treatment. And I've done several knee replacements with the Mako, and of course several without. And I can definitely tell you the patients who have had the Mako, especially the ones I've done one side on, where they've had a regular traditional knee replacement, and then I've come and done the other side using Mako. They have 100% all said that the Mako was hands down a better experience. They felt less pain. They got their range of motion back much quicker. Our therapists are graduating them faster. Overall, it's been extremely wonderful in my practice. And so patients, they love it.
Well,
I love it.
we hear a lot about robots, and specifically with Tesla with self-driving cars. Does this just drive itself? Do you just sit back with your hands in the
No, it's not quite that. I mean, I still have to drive it. But yes, it helps guide me where I need to go. It helps keep me from making mistakes, and that's wonderful too. So if I go too far in one direction or too heavy in one direction, it'll stop me. And so but I'm still the driver. I'm still doing the exposure. I'm still doing the final checks. I'm still able to change things that don't go where they need to go, and so I'm still the driver.
Now, one of the things you told me about is when you did the traditional knee replacement, you used to have to put a rod inside the bone. Maybe tell a little bit about the trauma that
Yeah, so the traditional knee replacement, in order to get our cutting block positioned where it needs to be so that we know our referencing guide, we have to use a rod that goes down the femur, and that is 100% eliminated in this because now we have a CT that plans our cuts for us without having to use additional instruments. We don't have to put a cutting block on the femur anymore. We use the information from this to make our cuts. And that definitely helps with a lot of patients for pain because we're not doing anything that aggressive anymore. It also helps our trays. We have very, very little trays that we need to open in the OR. And so we can cut down on issues with sterility. And so all that is eliminated with this system.
Well, it makes it a lot more efficient for the teams. There's less things open, less things that need to be re-cleaned.
Re-cleaned, yep, and less possibility of having an unsterile environment or something that could contaminate the wound, all gone.
Now, Carla, how was it when you first did your first case with the robot? What was it like trying to figure out this monstrosity? Because it is rather large. It's about 4 or 5 feet tall, and it's rather large. How was that for you?
It can look a little overwhelming, but we did some labs with it. Everything went great. And then once we started seeing like some of our patients coming back and the great things that they were saying, and they're getting up and at it faster, it was just a no-brainer.
Now, in terms of the instrumentation that you have to manage, because that's one of the things that you manage here with Dr. Migliore, is there less instrumentation that you're having to keep track of and
I think
keep
that
organized?
I think it makes the scrub techs happier because we have less trays.
Yep.
It's easier to learn because there's less instrumentation. We're always there to help guide them as well. And just overall, like the sterility part, if you're opening less trays, there's less chances of contamination.
Oh, terrific. Now let's talk about how long were patients staying previously, a couple years ago, when they had a knee replacement? How long were they staying in the hospital, and what was their recovery like?
I would say that traditionally, even more than a decade ago, patients were staying more than 1 or 2 days in the hospital to recover because pain was an issue. This is a very painful surgery, and so it was difficult to get them up out of bed and motivated to ambulate well enough to return home safely. Now we have a lot of changes over the last decade, even the last 5 years, not just with Mako, but with our techniques for pain control, our nerve blocks that we provide, our Exparel that we inject in the knee, and then adding the Mako has also shortened their time. Patients on average stay at the most 23-hour observation, even some patients going home the same day without difficulty because of this, and so it's really going to change the way that we treat patients.
Now, I know that early mobility of patients, specifically in joint replacement, is really important. Then how quickly are folks able to get up?
I would say on average, patients who previously had a traditional knee replacement may have taken at least 2 to 3 months in therapy to feel like they've achieved 100% range of motion and function. But here, patients are graduating in 4 and 6 weeks in our PT department. They're going home and doing their own program quickly. They're off their assistive devices faster. And of course, their pain level's down. They're using less narcotics, and those are all just wonderful things to have.
Well, I know you see a lot of patients who are in quite a bit of pain. Talk with me about the change that having a knee replacement makes in their lives.
Oh, I hear it all the time. Patients who, especially when they need bilaterals, once they've had both knees, they'll come in at their checkups and say, I'm doing this and that, things I haven't done in years. I just had a patient come in this week I did bilateral knee replacements on, and she's like, she comes in, wants to show off, look at how good I'm doing, I'm in the gym, I'm doing this, I'm hiking, I'm enjoying time with my friends, things that I've never done in years, and they're very happy.
Now, what would you say to an individual who's trying to decide when, they've got some knee pain? How do they know when is the right time?
That's a good, I get that question all the time. So obviously pain is one of our indicators for needing surgery, but of course daily non-operative management, obviously imaging that reflects the need for a knee replacement. But I think probably the deciding factor is when patients can't sleep at night. That's probably when they come in more often. You mess with somebody's sleep, they're in here. But I think activities of daily living, work environment, once they're affected, they're ready to do something about it. They don't want to miss out on life.
What would you tell somebody who is maybe walking around, hobbling around? What would you say to that patient who you just look at and needs a knee replacement? What would you want to tell them?
I would tell them not to fear it. Obviously we do a lot of knee replacements and we have great success. The success rate of knee replacements is over 90%. And so I think what most people do is fear that they're going to have one of those scary complications. And I talk them through the risks. I talk them through the preventative measures we take. We host a joint class pre-surgery that they attend to get some information about it. And I think once they kind of go through all that process, they start to feel a little bit more comfortable that they're making the right choice. And I can definitely tell you that the patients agree.
Yeah. Well, Dr. Migliore, Carla, I just want to say, here at Kettering Health Hamilton, we have the distinct privilege of welcoming new life into this world, and you all are the team that helps folks get back to alleviate pain and to get back to the things that they love. But it's the way that we treat people that defines our success. And so I just want to say thank you, both of you, for the work that you do in the lives of our patients. It makes a difference in their lives, to their families, and their community. And it's really exciting. We've got this technology here, but
Yes.
more than that, it's the people that make a difference.
Yes.
And so thank you for being on Team Hamilton. Thank you for working here. And it's just an absolute privilege to serve alongside both of you.
Thank you.